We'll move on now to the Vesiculobullous Disorders. Erythema multiforme, we've discussed this in several sections already. We have talked about urticaria, and we've talked about how it's a spectrum of disease. It can lead all the way to, for example, Stevens-Johnson's. You will see these target-like papules with an inner pale ring, and usually these do not progress to Stevens-Johnson. They can be triggered by viral infections, and they can itch, and they blanch. So basically it's supportive treatment, and they go away. And here's a patient with just florid erythema multiforme. And they're raised. These are raised lesions. They're confluent. They run into each other. If you push on them, they blanch, and then they fill up again, and they itch. Sometimes it is triggered by viruses. Sometimes it can be triggered by medications. Stevens-Johnson syndrome involves deeper layers in the oral mucosa. So look for these macules with a central area of necrosis. They can form vesicles and these large bullous lesions, and then the skin basically peels off. They will affect the mucous membranes. And so it is a more widespread disease and a deeper disease than erythema multiforme. You can have burning and swelling. Mycoplasma is notorious for triggering Stevens-Johnson syndrome, but a lot of these are going to be drug-related, particularly sulfa drugs. Also look for anticonvulsants as a cause of Stevens-Johnson. The treatment is usually supportive and symptomatic. There is some controversy as to the role of steroids, so they probably will not ask you about steroids. This is a patient. You can see how it looks like the lips are just peeling right off, and that is Stevens-Johnson, so it affects the mucous membranes. So now you have reached the end of the chapter and the end of your time with me. The pep talk that I always give the students at the end of the live lecture goes as this. You are well prepared to take the exam. Go back, go over the lectures, go over the slides, look at the pictures, and do your questions. I never wish you students for this exam luck. It's not a matter of luck. This is a matter of preparation. Do these things, go over the questions, and you'll be fine on the exam. Thank you for letting me hopefully impart some of my pediatric knowledge to you and to help you pass the test, and I'll see you on rounds.